doing 20 questions or 30 questions at once is very different than doing 175. You will get mentally tired.
Mm-hmm.
Yesterday, I was speaking to someone that said she started her test, and then after question 15, she felt like giving up, right? So it can be complex, and think about all the emotions that you are going through on your test day. We have a diagnostic test that's very, very close to the real test. If you're scoring 80% on the first time, it's very, very strong indication that you will pass. Okay. So
Yes.
when Plaza give you 175 questions, it's like the real test. Okay? So back to the Kahoot and next week. Uh, if you see the answer, press on your phone to get the answer correctly, fast as possible. As far as next week, no Kahoot. We'll, instead of doing a 6 hours crash course review, we'll do a 3 hours and 3 hours. So it'll be next Saturday, next Friday, Saturday. I highly advise you to be there. Take the notes. We'll be presented in a different format. The course, you can have it, it's already recorded, it's there for you. So I want you to watch the course, download your PDFs, prepare for the class. The class will be presented in a different format so that we can get more out of this rather than repeating what's already been recorded. Okay, we can talk
What
more.
time? What time is it gonna be next week? Next
It's going
Friday
to
and
be
Saturday?
next Friday and Saturday is going to be 5 o'clock and 5 o'clock, 5 p.m. Right? It might be a 4 hours Saturday and the 4 hours Friday. The hours obviously I always want to be mindful of your time, but my number one priority is your success. So that means that we can finish whatever is for the day, and we'll stay behind as long as you have a question or concern. So at the end of the course review, you should leave there feeling pretty good overall. It's a lot of content. If you just came for the crash course review, it's going to be a lot. But if you've been in a course and you've been doing the work, it should be just more of a review because we are repeating the same thing in a different format or with a little bit of a twist into it. Okay, we'll talk more about the crash course review after the game. We are about to get started. So good luck, everyone. Yes.
Is the crash course next week? Is it free too?
What do you mean 42?
I'm sorry. Is it free too?
No, man. So that's part of the crash course review, and they're also part of the 30 days PMHNP Walk to Success. This PMHNP Walk to Success is everything. It's the crash course, it's the module review, question bank, diagnostic test, everything. Instead of saying, hey, buy one, buy two, buy three, we put everything in one package together. So that way you're not spinning your wheels. We're trying to save you time and money in the most effective way.
Okay.
So that's for those that are in the course, okay? So we'll be spending about 8 hours together, 4 hours on Friday and 4 hours on Saturday. All right, everyone, we are about to get started. So good luck. Remember, Kahoot, you get points from being fast, and you get points from obviously being right. After each question, we take like a 2 minutes break to help you better understand the question. I'll have the full rationale after each question. All the answers are incomplete. You have to use a little bit of imagination to try to understand what the answer says, because it does not allow me to give you a full answer. Good luck, everyone. You have 1 minute to answer the question. If you're new, you have to press the colors. Nine second, 8 second, pick an answer. Any answers at this time and done. All right. So this one is kind of hard, right? I'm sorry, couldn't hear you. Okay.
I don't get this one. I don't get it.
Oh, yes, you do.
It's everything in the world. It's
Okay.
to itself and others.
Involunteer
You're
hospitalization.
going to talk about things.
All right.
And-
So
and-
let's take a look. Let's take a look on the answer. Okay. 1 second, please.
Safety plan.
Safety plan, right? Oh, who understands what's the difference between a safety plan and a safety contract? Anybody?
I don't see any difference. I've never heard that explained. A safety plan is a safety contract.
Safety
not-
contract.
No.
Safety
Right.
contract.
No,
is
hold on,
different.
guys. 1 second, please. This is one of the most crucial mistakes we have to address like immediately, right? Safety contract. It's always the incorrect answer. Always. If you hear safety contract, you can cross it. I'm going to be very absolute on that. Usually, I never say that. Now, a safety planning is something that really, in my opinion, or at least this is what we do in my hospital, is a step-wide decrease in crisis prevention. 6 steps in it. Basically, it walks the patient on what to do if they start to feel anxious, suicidal, nervous, in order to decrease a possibility of a crisis. And then when they get to step 4 or 5, I tell the patient, at this moment, I would like you to call me. Before that, they have used distraction. Before that, they have used locations. Before that, they have called a friend or family member, right? When we get to step number 5, I'm not going to go over each of the steps. I tell the patient, at this moment, I do not want you to do anything else but call me or possibly go to the ED. Right? Step number 6 is clearing the house of possible excessive pills, medications, lethal weapons, right? So it's a step-wide decrease in crisis prevention. Very different than safety contract. Safety contract is always a no. Okay? Because it has been shown that it does not work. It's a shift of care. Maybe about 5 years ago, safety contract was the thing that everybody did. That's no longer the standard of care. Can anyone give me a little bit different rationale of exactly what I said, whether you agree or disagree?
Dr. Lopez, I disagree.
Please, go ahead. Yes.
When I read the question, it says the client is what is there danger to self and others? So is that the right time to start a safety plan when there's a crisis going on? I was thinking that I would give some antipsychotic to manage the manic episode. Maybe I jumped too fast, but I know you're supposed to do an assessment, but I don't think that's the right time when there's a crisis going on that you are getting a safety plan in place with the patient.
Right. So does it mean that I can't go back to the question to read it exactly what I said? Anybody took a picture of the question?
There's no time to take it.
Always do.
It
But I was
takes
so
you
sure
that
about it, I didn't take a picture.
you put the safety plan in place before. Insurance. You
Before.
touch on it before. Not during that time. They would know what to do.
Exactly. Right?
Can I give an example? Can I give you guys an example? So I had a situation where my daughter is autistic, right? I don't want to say that, but when there's a situation going on, that's not the time to give me a safety plan, because if there's a
Right.
crisis going on, I'm not going to be in the right mind to listen to what you're telling me when I have a crisis going on at that
True.
time.
True.
So Dr.
So,
Lopez, one
yes.
thing that it doesn't, the question does not, just because you do a safety plan with someone does not mean they're not going to be admitted. The principle that this covers is autonomy. So
Yes.
that's one of the ethics is autonomy. Patients have the right to make the choice. It doesn't say that she's unable to make a choice. It just says that she's manic. So in her current safety plan, each time someone comes to an ER or in an assessment, there is a safety plan that you take place. And when we're talking about ethics, that this is autonomy. And the other thing is you really can't hold someone against their will if they're voluntary for treatment. This does not say that she's involuntary for treatment. It just says that she's manic and she can still make a decision for her treatment.
Yes.
So
So
can
you
I-
said, I don't have the question in front of me, but
Dr.
this
Lopez
is
is at the
exactly what
bottom. It's at the
was-
bottom, Dr. Lopez. It says, what is the immediate priority when the patient is in a manic episode and may pose a risk to themselves or others? Is that a safety plan that we doing? And that's the immediate priority when there's a risk to self and others? Immediate doesn't make any sense to me.
Man,
Yeah.
She still gets the choice. She still gets the choice to decide whether or not she wants to come into treatment or not. That's part of your immediate safety plan.
Okay.
Every time you meet with the patient, you have a safety plan. Each time their condition changes, you have one. Reading too much, if she was involuntary, it doesn't say that she's involuntary. It says that
Okay.
she's manic. So part of that plan would be discussing for her autonomy, here is a choice that we have for your safety plan. Are you willing to come into the hospital? It's the least restrictive.
Okay. So yeah, so we'll go back to this question. I want to, because I didn't take a picture and I cannot go back. I want to just take a look more on the question itself, but the rationale that he's saying is what I'm alluding to. But be mindful that that's the answer would be the correct rationale would be posted here, a more of a full answer, because the Kahoot does not allow me to give you a very comprehensive answer choices. Okay, but we'll talk about more about safety planning and when and how to implement it, and specifically, where's the line? Where's the line between hospitalization immediately, I don't want to hear, and where we can collaborate with the patients? Now, I want to be very specific of what we learned yesterday and how we're applying today. Someone being manic is not a reason for admission if they don't want to. Now, I have to look back in the question. Did they specifically say pose a danger to self and others? Right? We'll go back to this question.
So can I ask a quick question? Can
Yeah.
I say, so if the question said if the patient was suicidal, if that was added to that, or suicidal and homicidal ideations, would that
Absolutely.
be? Okay, thank you.
Absolutely. Then we have a much more clear line. But what we learned yesterday, what case in psychiatry says that mental health disorder alone is not a reason for an admission? Anybody that took the class yesterday?
Oh, that's Donaldson versus Connor.
O'Connor, right?
Connor, yeah.
Okay. So what happened to O'Connor? I mean, for you guys that are new, I don't usually say the whole case. I just say one part of the case to save you brain power. So what's the story about this case here that we discussed yesterday? What happened to him?
He had a long-term incarceration just for having a mental health condition, not because he needed to be locked up.
Exactly. So we did the story of what happened to him that makes it easy for you to remember. Yeah, so mental health alone, I know the manic sometimes even psychosis. I had people with huge hallucinations, and I would not admit them just yet. They need to give me a little bit more. It's all about their safety and safety of others. But
Doctor,
good discussions. We'll come back to this, otherwise we'll be here for a long time. Okay, guys? I'll be back at the end for question number 1. We'll talk more about it. There will be plenty of discussions throughout today's event. Understand that the Kahoot does not allow me to put a full answer. You have to be a little bit creative trying to understand here, okay?
Are we able to get the recording part of all this that we are doing?
1 second, man. I can't stop anymore.
Okay.
All right, so this one's pretty clear, right? So MAT, what's MAT stand for?
Medication assisted treatment.
Medication assisted therapy.
Okay, and that's usually refer for substance use disorders, right? So as a PMHNP, you can initiate assessment, treatment, and rehabilitation with MAT, right? Now, you do not need to refer to a counselor first. You can collaborate, but you don't need to refer. Remember, passing the bucket. If you have a problem, you have a patient, and it's within your scope, you don't pass to others, right? Inform that the patient, as the PMHNP, you are not authorized to provide MAT would be absolutely incorrect, right? MAT, it can be more than Suboxone or naltrexone. It can be many medication, right? Encourage the patient to seek MAT from a primary care physician. Again, it's passing the bucket. I think all of you guys, most of you guys got this one correct. Again, understand that it does not allow me to give you a full answer. I have to be very creative. Sometimes spend lots of time trying to put an answer that may help you get it correct, at least the initial rationale. That's the complete rationale here. All right, next question. This one's going to be complicated, right?
Yeah.
Okay. So are you disrespecting the patient by explaining the risks of refusing hospitalization? You document and assess for safety. You're not disrespecting the patient, right? Compared to respect the patient's autonomy and provide an outpatient treatment options. Like, okay, I'm manic. I have this super pressure speech. I never said anything that I'm dangerous to myself or others. I just want to build a restaurant and sell lobsters all day long. This grandiose team that oftentimes manic patients do come with, right? I'm talking to my provider. I'm speaking super fast. They can't understand me. Yeah, sir, I want to start a restaurant and sell lobster in Maine, right? Some crazy idea, right? And the provider says to me, hey, I think it would be a great idea if you get hospitalized so we can get your these conditions under control and so forth. And I say, no, I don't want that. I think option A, I mean, the blue option there, it really encompasses respecting the patient, but you want to give them the full disclosure as much as possible. You should not forcefully admit the patient, but between the blue option and the very strong brown option there, which is to respect the patient's autonomy and provide an outpatient treatment, which one would be more of a comprehensive answer? Remember that in a test, you are most likely to deal with a question like that, where one is the correct answer, option two, it would be the most correct or more comprehensive. Yesterday, we learned about, let's say, reading. Someone cannot read or someone cannot write will be one of the answer choice compared to literacy, which would encompass all of reading and writing comprehension, right? Healthcare literacies. So this is explain the patient the risk for refusing hospitalization, document and assess safety. Again, I cannot give you a full answer. This is as much as it allows me to do on Kahoot. It is the best answer, right? A little bit better than the other answer. You are still respecting the patient's autonomy, but you're going a step above by documenting, reassessing, and trying to coach the patient into making a right decision for the patient. However, at the end of the day, the patient has the ultimate say whether they will want admission or what's the next step on the treatment. All right, next question. Remember, I cannot give you a full answer, okay? All right. I knew it. I knew it. This one is hard, right? So I took the picture here because I want to go back to this. I'm pretty sure you got it, the entire question, but I'm going to the part that matters here. Says here that the patient occasional thoughts of self-harm and and reports having specific plans, such as, do you have a suicidal plan? I would say occasionally I think about it. And the patient, I would say how? And the patient, I would like to jump from the bridge next to my house. And then I'll ask, do you have a way to get to the bridge? And he would say yes, right? He's not saying he's going to do it, but he has a plan. That's close enough to call for admission. The patient has occasional thoughts, is hopeless, anxious, as the question said, and has a plan, and occasional suicidal thoughts. Would
I thought
you?
it said they do not have a specific plan. That's what I thought it said.
Yeah, it said and, but and. It should have said and only, right? Because I knew it. This is the part that would take you from the right path. Guys, I promise you that every single question will have a distraction. Patient has a plan and thoughts, even if it's occasional, it's a serious case. How would you go home thinking about it? I know it's hard, right? You do not want to take someone's freedom, and you want to make the best decision for the patient. Now it's over the weekend. How would you sleep knowing that you decided, due to your clinical judgment at the moment, to let this patient go home? He has a plan and occasional suicidality. I know that I would not sleep well. I probably wouldn't sleep at all. And if you have any of those gut feelings, you'd rather be on the side of safety. Okay? Because it will take you 10 years to get where you are now. And it only takes 30 seconds to destroy it. And that's just a part of the consequences. You want to be wrong 99% of the time. But the one time, the 1% that you'll be right, reasoning towards the safety, would be all worth it. Yesterday, I explained about ER doctors. They don't care about GERD. They don't care about missing those small things. What they care about is not missing cardiac issues, strokes, thrombosis. I can miss all day. Oh, it was GERD. I didn't catch that. What I want to rule out is for possibility of cardiac, imminent danger. In this case, it could be possible that the patient goes home and nothing happens. But as a provider, I would not sleep well knowing that the patient has a plan and occasional suicidality and reports sadness, hopeless thoughts, right? Or feelings. Okay.
I just thought there had to be intent as well. So that's the only reason why I had, at the same time where
Yeah.
you ask of course,
Right.
because many people have a plan, but they like, I have no intent. And that's usually the follow up in that. But that's what I was on the fence for. That's the reason why. So that's why I wanted to hear what you had said and looked at the explanation as well.
Right. So that's an excellent point. That's real life. In the test, it was on purpose, or will be on purpose, not mentioned. It didn't say that the patient does not have an intent. It didn't say the patient has an intent. It was left out. Whenever you will encounter in every single question, the lack of explanation or not giving you the full detail. Do not include anything or take away anything from the question. In that case, it's all what you have: occasional suicidality and the plan. So at this point, I should not consider intent or not intent because it's not said in the question, mentioned in the question. Great point. Thanks for chiming in. This is very important. Every single questions, you will encounter that. Specific example: major depressive disorder. What do you need? 5 symptoms over 2 weeks period of time, plus bunch of rule outs, right? Do you think the question will ever give you 5 symptoms over 2 weeks period of time and give you the rule outs? This would be the appropriate diagnosis per DSM-5. However, at the end of each question, it says, what would be the most likely diagnosis? So we cannot just say, oh, It's not major depressive disorder because it has only 3 symptoms, right? But it's questions that asking what's the most likely diagnosis. Great discussion there, guys. Thank you for that. All right. So here we have all the telltale signs between admissions and not admission. One of the specific why not the green option there, right? Initiate immediate hospitalization due to suicidal thoughts. Having suicidal thoughts is very serious, but you need a little bit more than that. You need a plan. Intention would make it super strong. So the question says, she denies any specific plan, right? So the best option here, think about this. How would the hospitals be, units be, if every patient that you saw, outpatient, said, yes, I'm super depressed and I have suicidal thoughts? We would be admitting maybe 1 every 3 patients with major depressive disorder, right? We could not possibly sustain that. So we have to find a balance. Suicidality, super dangerous. However, it's not alone a reason for admission. We need a little bit more. We need a plan. A plan and intention is what we hope the patients would not have, but if they do, we want to get the information, right? So in this occasion here, adjusting her medication and continue to monitor her symptoms for safety and so forth, maybe asking the patient to come back in 2 weeks. Developing a safety plan would be highly advisable at this time. Next week, I'll go over on how to do a safe planning if anyone else is interested. So remember, we do not want to discontinue her medication and refer for somebody else that may do similar things that we are doing. Okay, so at this time, let me read the question again for you. So I'm going to skip right to it. So during the assessment, he admits of feeling hopeless, having perversive thoughts of ending his life, and having a specific plan involving overdose, so availability, right, of the medications with available medications. The question even said that. So he states that he has already collected the necessary medications at home. The questions on the test will never be this strong. Okay, as far as I'm going to do it, I already have a plan. I already collected my meds. I have it available. His affect is flat, so he clearly is depressed, and he expressed a desire to end his life. So in this case, collaborating with the patient to develop a safe plan is a great idea, but this is way beyond safety plan at this moment. Okay, and prescribe medication. At this point, you should be keeping an eye on your patient, collaborating with the attending physician, explaining the situation and that you would like to have this patient admitted. Now, you want to collaborate with the patient to get this in a peaceful, as peaceful as possible. However, this is a clear case for admission. Anybody else disagree? And if you do, please say it, because now is the time to get those moments and situation better understood so that you can ace your PMHNP board certification. I highly doubt that the questions on the test will be as strong as this one for an admission, right? This one has all the signs that this patient should be admitted. So if maybe you picked the incorrect answer by mistake, or maybe you have doubts of what would be the right option. Either case, I'll be available at the end of today's encounter to provide some support if you need to, okay? Okay, again, very close between the blue option and advise, and respect the patient autonomy to discontinue the medication and provide education. So if the blue option wasn't there, the red option here that I just read to you could be a possible answer. But which one is the strongest? It's the same case as before, where the blue option engage in a collaborative discussion about the risks and benefits of the medications. It doesn't allow me to give you a full answer. Okay, so do you think that the blue answer also respects the patient's autonomy? I will respect your decisions to discontinue the medication. However, I would like to discuss the risks and benefits of doing so, or keeping as we are, or changing the medication. I want to give you options. I'm still respecting the patient's autonomy. At the end of the day, I am just a guide. The patient is the one that drives the care. PCC, patient-centered care, right? The model of nursing in psychiatry is based on that. It's a holistic approach, putting the patient at front of the treatment. Okay, next question. Ten seconds left. All right, so respect the patient's confidentiality and refrain from informing the parents. How old was the patient?
19.
19. If this patient was 16, would you still pick this answer?
No.
No.
Yes,
Yes.
yes, yes, yes.
No.
Okay, no, or anyone that said no, why would you not? What's your rationale?
For me, I think because it's not, they didn't state it there that it's emaciated.
Okay,
Yeah.
okay, all right, that's fair. I like what you said, it emancipated, right? And the person that said yes, could you please help me understand why yes? Yes mean yes in a meaning, in the sense of I would not tell the parent. Okay. All right. So in psychiatry, you will be faced with this dilemma. I promise you, especially if you're dealing with kids. Now, what we learn, and how do you lose trust of a patient, especially a minor? How do you create trust with a minor?
Keeping your word.
Confidentiality.
Keeping your word, right? So at that point, you need to assess for safety, but keeping your word and your promise to the patient up front on your first interview. You're going to do informed consent, and you are going to tell the patient, these are the things that I will tell your parents, and these are the things that I may not tell your parents or will not tell your parents. If the patient's 16 and says, I occasionally use marijuana, right, or something of that nature, it's preferable that you do not tell the parents. Now, similar situation, 16 years old, I'm going to say a female, having sexual relationship with a 35 years old man. At that point, would you tell the parents or not?
Yes, I'll tell.
Okay.
Because of the age difference.
Because of the age
That's a
difference,
safety issue as
and
well.
that is what we talked about yesterday, the breach of confidentiality, right? Give me 3 examples or 4 examples. When would you breach confidentiality?
When someone is a danger to themselves and others.
Perfect. Anyone else? Or please keep on going.
Or the insurance company.
For the insurance company, they gotta pay for. Perfect.
Yeah.
Anybody else?
Propinas.
Court.
Court is asking.
Okay. The judge or the lawyer says you have to. Perfect. Or the last one that comes to mind,
Danger to self.
Child or elder abuse.
child and elderly abuse. So in the
Correct.
case of, there is one more that comes to mind, but that's child and elderly abuse. It is considered an adolescent under 18 years old, 16 years old. That could be child abuse, right? I will call it child abuse for umbrella term here. In that case, you are a mandated reporter, okay? So that you would disclose. Now, what is another example in which you will break the confidentiality due to emergence procedures, right? You found someone else on the ground, implied consent is implied at that point, and that you can call, ask for help, discuss the case if you need to at that point. Okay, so great discussions, and we have to be thinking about that. It's likely that you get a question similar to this in which you'll be pressed between the parents, the people that are paying, the people that are bringing the child to the treatment, and you're honoring the child and the trust and building the bond. The moment that you reveal that that person is using a substance, illegal substance to the parents, it is very unlikely that you will see that patient again. You completely broke the trust. I'm not saying this is an easy decision. And in real life, you have to be very comfortable and you have to put the rules right up front so that they know what's the line that they should not cross. If they review you such a thing, you have to take actions, right? Very,
So-
very clear.
There's
Go ahead.
no ethical obligation to report that the child is using felony charges type drugs. You couldn't be sued later for it being found out you knew and didn't tell the parents?
That's a great question. I actually don't know that if you could or could not. Yes, you could be sued. You could be sued for waking up today and looking wrong at someone else. Yes. However, in the test, it would not push you to like extreme as you saying here, right? So you put in a way that's, yeah, she using heroin and so forth, and like hardcore. It's not substance abuse. We don't know exactly if it's alcohol or what might be the case. So again, not putting stronger words into a question that is not in a question. Okay. So we cannot always look at, oh, this is how I do it in my hospital or in my city. And remember, this is a national test. And the team here is the building the trust between your patient and you, and when to break this trust, right? So if you look at the breach of confidentiality, it didn't say anything super about, it said imminent dangerous child and elderly, right? So now how you take that, we have to look at the question. If that's pose an immediate danger, absolutely. By all means, you have to. But the question was not specific, so let's be careful with not adding specific conditions or what if of life, right? So this is all about the same dilemma. Okay, so it's a 17 years old. The only way you are going to build trust with the patient is by ensuring that if it's not a danger to self or others, the therapy will remain confidential. And that's why the question said, and this, I'm glad it did, it brings a dilemma. It's hard for us to be in between. We really want to tell the parents, and we really want to respect the patient's autonomy. It's very, very likely that you will get a question similar to this. Very likely. Why? Well, this is something that we see every single day in psychiatry, in practice. If you're dealing with children and adolescents, you will be dealing with this every single day. You really want to tell the parents, but you need to decide when and how it's appropriate without losing the trust of the patient.
But in this question, the parents wanted to be in the room and she's a minor. They have every right to be in the room, whether the patient likes it and therapy works out or not. She's a minor.
Sure, she's a minor, but she has the right of confidentiality, right? So
What
she has a
age?
right. Yeah, she has a right to confidentiality. So we talked about the 3 patients' right yesterday.
Can a 10-year-old?
Okay, guys, let's not
What age?
17.
Yeah, let's not the ifs of life. If it says a 10 years old, it'll give you more specific. I don't think the test would ever put you in a take just 17, put a 10 in there, because that's really doesn't. So a 10 years old, let's go back to a 10 years old. Can a 10 years old sign informed consent? Yes or no?
No.
No,
Why?
Decision
Because of
making.
the
they don't have
age.
the capacity.
Perfect. Capacity. We went over this yesterday. She lacks the capacity. In order to have informed consent, we need 5 things. We need capacity. We need to be able to understand. We need to do the risks and benefits. So in that case, yes, a 10 years old is a very different than a 17 years old, right? 17 years old is more towards an adult.
Yes.
And if the patient says, hey, this is my confidentiality, it's confidential. Until it's not, until it is needed to be reported. I don't want you to start imagining situations and creating this anxiety provoking that it does to everyone, right? So,
But in this question, it said the parents wanted to be in the room for therapy. And so she is almost not a minor, but legally that means she's a minor.
sure, yes, the parents would like to be in the room, but the patient has the right to confidentiality. Right? So
Dr.
we can
Lopez,
go on this all night long between back and forth, and neither is it's kind of productive or helpful, because the patient says, hey, I'm 17, I'm not gonna actually be here at all, so you two can talk. You guys want to talk, go ahead and talk. Who's gonna force the 17 years old to come in the room? Certainly not me. So we have nothing going on at this point.
The answer also said, the correct answer said, include them in the decision making. So that means you're talking with them about what the parents want and they want. It doesn't say that the parents aren't going to be in the room. It just says, because you have, with adolescents, you have consent and assent. And so what you're doing is including them, the autonomy for them to be included in the discussion. But as a therapist, I can tell you that 17-year-olds are not going to talk. And I tell their parents that, look, we can do that, but she's not going to get any better. And so if that's going on, there's a family problem. So but the answer is autonomy, including her in the decision making, not saying either way. So that's why I would choose it.
Yeah, absolutely. So it's the autonomy, right? And we can look at questions and be very concrete, take it word by word. Or we can look at the question globally, assess for safety, and see if, like, okay, what is the question really trying to imply? No questions in a test will ever be specific in a sense that will give you everything you need to know to make the proper decision. Okay? It will give you just enough. Someone has a hot mic there. Perfect. I just want to give you guys a little bit of what possibly could confuse you. All questions, not all questions, but question that comes autonomy. Is your autonomy of prescribing doing things under your license, or is referring to the autonomy of the patient?
Autonomy of the patient.
Autonomy, that's the first point. Okay. Why do I say this? Because it's likely that you get a question in the realm of you have prescribed a medication to a patient, medication X, and the patient is stable and doing relatively well. However, FDA have subsequently issued a warning about medication X. In that case, what are your options? Would you discontinue medication X immediately because of the warning, or would you continue with medication X because maybe benefiting the patient? I'm simplifying this, right? So what will be the best option between discontinuing because the FDA warning or continue the medication in that case?
Continue with education.
Continue the medication, okay? You do not discontinue your medication because the FDA came up with a warning. What you need to do, best answer would be look back at the literature to find support for the reasons to continue the medication. But here is you using your autonomy to make the decision. However, autonomy most of the time is about the patient. And the questions could come in a sense of trying to confuse you between your autonomy to make decisions and the autonomy of the patient. Non-maleficence, what is that? And give me an example. A good example that we talked about yesterday.
Doing no harm.
And an example.
Trazodone.
Why?
Trazodone can give priapism, but
Okay.
if you know that one and the patient is telling sexual dysfunction, we need to stop the medicine.
Yeah.
Okay, great example. Give me another example of that in relation to substance abuse.
Patient with ADHD, a patient is taking alcohol and patient is on taking drug abuse, and patient is stimulant. We prescribed stimulant. So when we know that that patient have a history of drug abuse, we should stop the stimulant.
Perfect. Excellent. Beneficence, what is that? And give an example. Anybody else? Somebody else, please.
Patient coming in with major depressive disorder, and I prescribe SSRI for the patient. Doing
Perfect.
good for the patient.
Yeah, excellent. Great job. Veracity is?
Telling the truth.
Okay. So telling the truth, right? So perfect. What is the I want to save this one because this one's kind of hard. We'll see again in a second. Let me get you the question first. But yes, be careful. We also mentioned that easy things like the ethical principle, 7 of them, you will see in the questions. I promise you will. Why? Well, we looked at the blueprint and it's right there. And we also seen this in nursing school, and you've seen this on your master's or doctor's degree. So it's very likely that you will see on the test. Easy concepts will come with harder questions. So make sure you not kind of know, make sure you can nail it. Absolutely, with no doubt.
Oh.
Okay. All right. So very surprised, very, very surprised that we did not get more of the blue option there. Inform the patient, the parents about the situation without the patient consent. Again, it's a 16 years old. I'm not saying in this case, you should not inform the parents. I think this is pretty clear that you should. It's a strong case for possible harm. But without the patient's consent, hey, I'm going to tell your parents, I'm not even going to tell you this, right? Without having this dialogue, is not the most appropriate answer. Umbrella answer is not really getting to the weeds of you should or should not. Discuss the importance of including parents and patient in the care. Basically, the best of both worlds, right? So respect the patient's confidentiality and not disclosing any information. This is what we want to do in general, but now it's really crossing the possibility of no return, right? And we don't want to necessarily do that. We want to always be looking for a safest option. So in this case, the reporting or talking to the parents, involving the parents, will be the best, safest option. Okay? And I'm not saying that it is an easy option. This is hard because no matter what you pick, it doesn't feel 100% correct. But that's why it's called the ethical dilemma. You're into an ethical dilemma between the patient that you provide care to and the parent. If it was easy, it would not be a dilemma, right? So it's very, very difficult. And you don't always go home feeling best about yourself or what you did. But what you want to ensure is that safety is your rationale for doing whatever you are doing. Please go ahead.
So I have a question. You had a previous question just now whereby it was the patient that had the drugs, I believe. So if that question had these two answers whereby it was to inform the patients, the one that had the green answer just now, and also to not disclose the information, which one would you have chosen?
It's difficult. It's very difficult because of, let me see here. It said, discuss the importance of involving parents and patient in the care. So this is an umbrella answer. It's not going to detail about I am going to do it or not. I'm discussing with the patient the importance of the parents should know, maybe you should know this to help you out and so forth. It's kind of like more of a comprehensive answer in which I'm not answering anything for sure yet. I'm kind of like discussing the situation. What it would be like if your parents were involved and help you overcome this situation? That would be the most likely answer, right? Because it's not taking any sides. It's taking the initial assessment and discussion about the case. So again, it's important not to really put yourself in a corner in which you have to take a decision. If I give you an umbrella answer, Like yesterday, we talked about suicidality. Where would you document suicidal thoughts on your documentation?
Thought content.
Okay.
Content
So thought
and
content.
mental
Now,
status examination.
if thought content is not there and the AMSC is one of the options, would that still be a correct answer?
Yes.
Yes.
Yes. So it doesn't say necessarily it has to be specific in one location. If you say MSE, it still would be correct answer. So that goes to say that the question can have several right answers. In this example, it doesn't really say that you will or will not. You're basically saying, hey, I hope that we can include your parents. I think they seem to me to be supportive to you and they really want your best. What do you think about that? In a sense, right? You have to judge for each question and for each example and kind of know when to cross the road. Ethical challenges, ethical dilemmas again, right? Again, it says which of those is most aligned with this principle. Okay, is it non-beneficence, doing good with more to those with more severe mental health? No, it's about justice. I only have a certain amount. We are going to distribute those care, the care and service to those in most in a fair way. Okay, now
And
we can go
this
into
in a terrible way. I don't get this because the blue question, the blue answer was talking about helping people that needed it most. If you got limited appointments, you're going to sit and chat with something who's doing real good on their depression instead of seeing somebody that's fallen apart manic because it's not their turn.
It didn't
Right.
state that specifically though. See, if you
Yeah,
looked at
you are going back to the-
severe mental health, so there's one say you can say depression or ADHD. The other one is schizophrenic. Doesn't mean at that time they didn't say about the level of care that's needed if they had. It's only because severe mental status. We already know someone with schizophrenia has more of a mental illness than someone just specifically with ADHD, but didn't specify that they were having like some manic issue or a severity. And that's the difference. That's why I had to read that. It was just saying severe, but doesn't mean everybody who's schizophrenic always goes first. It doesn't mean that at all. You could be fine on your meds. So that's the only reason why, if you read that again, that's the only thing I saw myself too.
Yeah. So I think here are the same thing is adding things to the question. But if you didn't look at the answer, so what did we learn yesterday? Hold on a second, guys. 1 second, please. When we look at the question, someone has a hot mic there, please.
Garden veggie. Then they have Chipotle, and then
Marie,
they have
Marie, have a hot
Maria.
Marie, mute your mic.
Somebody's ordering food.
I know, gotta eat. So how do you prevent yourself from getting the wrong answer? If you didn't see the answer, you read the questions, what we learned how to apply. If you had applied this, you would have got this question correct. If you read this question and did not look at the answer, which ethical principle would this most be applicable to? Remember yesterday we said we can make any of the ethical principles make ourselves believe it is the correct answer. If you look at the question, let me read it to you without looking at the answers. Never look at the answers. You look at the question and say, what is the core of the question? Okay, I have to find which ethical principle this question is most applicable to. What would be the one that would come to mind? And then you look at the answer and confirm it. Which one comes closest to your answer? So let's take a look on the question. A PMHNP is working in a community mental health clinic that has a caseload of diverse patients. The clinical resources are limited, and there is a shortage of available appointments due to a high demand of mental health service. The PMHNP is faced with the ethical challenges. So basically saying it's going to be hard. It's not a clear cut of prioritizing access among those of their patients. Which ethical dilemma should the PMHNP prioritize? Beneficence. So if you look, regardless of, we also cover for an answer to be correct, the entire answer needs to be correct. So beneficence in itself, what is it? Doing good for the patient, right? We give an example of SSRI, imagine depressive disorder. And then they went on to say, the PMHNP prioritize patients with more severe mental health. Does it really 100% falls within the terminology of beneficence? What we know of it, right? So what we'd say is, hey, beneficence is doing good, applying the treatments for those that are needed, right? Now, what comes to mind about justice, fairness, right? And then matches the answer as the strive to distribute available appointments fairly. It's all aside. Which one's the umbrella answer and which one falls closely with what you thought about when you read the question? And that should have guided you undoubtedly to the right path. So when you read the question, ask yourself, what is the core of the question? What is the question asking me? And answer that question in your head. Then read A, B, C, and D, and look for the traps. Here said beneficence, semicolon, I believe, and to give you an answer that doesn't quite fit 100% the definition of, it could make it fit, right? But traditionally is not the answer for beneficence. And there's not a stronger answer than, what was that option there? It was justice, right? Which is being fair. And they give you a full answer to that. Okay, hopefully that helps. But ethical dilemmas are hard. And you can make it a case for either way in your head. Very easy to do so. I can see why I can make the case for beneficence. Yes, I'm going to take that patient because the patient needs most, right? Like a ER, right? If I'm waiting for an hour, somebody else coming in, they might take my place. It just arrived a second ago. So it's the same question. So you have an ethical dilemma. What ethical principle would closely align with this question without looking at the answers? Okay. How is this question different than the previous question? In a sense, if you read the question and you know the definitions of the ethical principles, does justice versus beneficence, which one is the strongest? Which one would you think, if you know the ethical principles, all 7 of them, 8 sometimes, which one would come to mind when you read that question?
Well, when I thought about it was when we were thinking of equity and, you know, being equal among, especially with different cultural backgrounds, and then also someone who doesn't have a immigration status, that type of thing. So you're always thinking that. That's what I thought when I was thinking of how to answer that question. So
that is a beautiful example, right? That's a extraordinary example, right? And sure, we can always make the case for beneficence, doing good, doing what's right, you know, benefiting the patient. But the core of the question really towards about being fair, right? Fairness. So try to read the question and answer the question without seeing an answer. And then you'll be surprised how much you know. But if every time you read the question, immediately you go look at the answer, you could fall into the traps of the test makers. Don't look at the answer. Think to yourself, which ethical principle would this question most likely align to without looking at the answer? Okay, so I'm sorry, this one, it was incorrect, killed in. So it should be autonomy of the patient. My apology. Sometimes it kind of just skips through it. So this is autonomy of the patient versus beneficence, but in the case of benefiting the patient, this one would have been autonomy. So okay, so we are getting closer and closer and closer to getting everyone on board 100% of the time, right? So again, this is a clear case of non-maleficence in which you emphasize the reasons why you will not prescribe a certain medication due to possible addiction or side effects, right? So a clear example, if you think someone is that may be addictive to benzos, I would say no. Let's give an example. Last week, I had a patient that's been on and off medication. He comes back and he said to me, I'm doing great. I said, great, awesome, man. I'm glad that no more reporting depression or anxiety. He's doing actually fantastic. Job is going well. I recovered from my pain. I prescribed duloxetine. And he said, there is only one remaining concern. I said, okay, what would that be? He said, I'm still having insomnia. I said, okay, so let me go ahead and possibly kill two birds with one stone. Let me go ahead. What do you think about this medication? Atarax. Usually it's not so much for insomnia, but there is a benefit for those that are suffering from insomnia and comorbid anxiety. He said, well, I really don't want to try that medication. He said, okay. I said, what would you like to try? He said, well, can you prescribe me again Ambien? I said, no, I can't. Why not? Well, remember when we first started treatment about 4 months ago, I said, I'm going to prescribe Ambien this time as a bridge because your duloxetine will not start working right away. It will take 4 to 8 weeks, usually 8 weeks, because I go very slow and steady. By then, your anxiety should decrease and your depression should decrease. And that's all what I need is about 30 days. And the reason why I would not prescribe to you again is because there is something called rebound insomnia. So at this time, I don't want to possibly have your body depend on this medication. These are my choices that I can offer you at this time, right? Not as strong as this case here, but in a similar realm. And these are real life examples that you would see. And I'm not saying that it is incorrect to prescribe again Ambien. Many people would. I just would prefer not to. I'll prescribe one time. The patients may continue to take their medication, and I'll work with them in their option, other options. I could say we can try trazodone, we can try Rx, we can even try a light gabapentin for a little bit of anxiety at night, 300 milligrams, right? But I would not want to go into a more of an addictive medication. These are choice. Neither is right or wrong. Okay, but this is how I would practice. This is how I practice. Okay, if you read this question without looking at the answer, which ethical principle would come to mind? Perfect, right? So we are getting closer and closer and closer. Maybe one of the reasons some of you guys are not 100% is maybe you haven't covered the ethical principles, or maybe you still have questions about it. But this is a clear case of autonomy. If I read the question and close my eyes and think about those 8 ethical principles there, sometimes 7, sometimes 8, depending on what books or resources you use, autonomy would be like my first one that pops up, right? Would be the strongest in this case. And then all you have to do is read A, B, C, and D and match what you thought it would be with a possible answer. Try that. It will not happen overnight. It's an exercise, but how you get good at it is by doing the question bank. Over 1,400 questions there. For each one of those questions, read the question and ask yourself, what is the core of the question? What is the question really asking me? And create a possible answer in your head and see which one of those answers are very close to what you thought would be. you'll be surprised of how much you know.
I attended the class yesterday, and
One second,
before
Bina.
also, yeah, I attended the class yesterday, and today I'm doing very bad.
Okay, 1 second, Bina, please. Okay. All right. So autonomy. Let's take a look here on this question, on the answer here, because I'm not sure if it was killed in. Okay. So respect and involve the patient's whole honoring the individual's right to make the decision about the healthcare should be prioritized. So it was killed in incorrectly, right? Respecting the patient's autonomy means involving the family only if the patient gives explicit consent, ensuring that their choices and preference are respected. So that's one of the questions that we could not give a full answer to it, right? So it wasn't very clear. So Bina, addressing your question, those things are easy to understand when we read, like the ethical principle. There will be hard questions because
I go through the module 1 week ago. Yesterday I attended your class, and today when any ethical questions are coming, for me it is very hard to find the right answer. Yeah. I'm all the way down today.
Yeah, no, it's okay. And the learning and recovery of any mental health condition is never a straight shot, right? We'll keep going up and down. As long as we keep on doing and moving in the right direction, we learn more, and we learn more from the mistakes. Now, keep in mind that the Kahoot is not necessarily a fair judgment because it doesn't give you a full answer. Okay, I only have a few characters that you try to confuse you on one hand, and the other hand pointing you to the right direction without being a clear answer choice, because the test will never give you super clear everything you need to answer. Be comfortable with making a choice with the information that you have.
Okay, thank you.
What is the correct answer?
It was keyed in, it was autonomy, right?
Yes.
Okay. Okay, perfect. If you are not licensed to practice in California, Arizona, and so forth, you should not practice there, right? Legal principles for telehealth practice require the telehealth provider to be licensed in the state where the patient resides, right? Stopping therapy at that moment would be the most appropriate action. Remember, guys, sometimes I call it going above and beyond for the patients, and sometimes in a sense of a, hey, Zoloft 200 milligrams is the prescribed recommended dose. Don't put yourself at risk by going at 250 and 300. I'm not saying that would not benefit the patient, but you are more likely in those cases to fall into trouble, and only takes once to do so. PCC is Patient Care Center. All right, so this is not an informed consent, right? Informed consent is about the treatment and options. We can always make any question sound like the answer we want to pick. This is clearly about licensure. If you're not allowed to do X and Y and Z in one state, this is. Yesterday we learned about the state board, the state regulations, right? The scope of what you can and cannot do in X, Y, and Z state versus the standard, the big umbrella made by ANA that says what all PMHNPs can do. Then you come to the state and they say, well, here in this state, you can go above or below of what is in the standard of care. Questions will try to confuse you between the scope versus the standard. Scope for the state, standard is ANA statement of the profession that you are getting your licensure. But the states determine what you can and cannot do in that state through their licensing process, right? Oops, sorry. Probably deleted the question there, so moving on. So if you were not in our class yesterday, you need to know PICO, page by the letter. If you kind of know, it's likely that you get this question incorrect. All right, between A and the red and the blue, patient, intervention, comparison, outcome, timeline, PICO. The blue option, population, so that could be patient or population, got it. Intervention, the same. Then we have comparison versus comparator, outcome, and time. Right? So it's a very fine line between the red and the blue. I want to really emphasize, if you don't know PICO, like if you can wake up any day and say what stands for, it is likely that you will miss this question. Questions like that, because that's the core of research, how to formulate the question for your research. And easy concepts will come with the hard questions. They could provide 4 answers that all starts with an I, and they all sound similar. And it's question number 175, and ask you to pick the correct answer. You are tired, you are frustrated. The answer choice seem all very similar because it's an easy concept. They have to make it as hard as possible. So please know pickle, cage, PDSA, the process of transforming performance improvement that we covered yesterday. So we can get those easy questions towards your PMHNP board certification. Should be level 1, the red, level 2, the blue. And then it should be level 3. So I apologize for the incorrect answers, the option choices. All right, so let's recap here. Very confusing between level 1 and level 2, right? So how this would be a level 1? It would be meta-analysis. I probably keyed in incorrectly. It should be level 1 versus level 2. Level 1, meta-analysis versus systemic review. All it's saying is I'm going to gather 10 well-established research papers. I'm going to put them all together to come up with one final suggestion. Compared to level 2, I'm going to do one well-controlled double-blind study and find out what is the outcome. Okay, so here the question was not well written, because if it should give you a clear answer, because there are close between level 1 and level 2. The difference is the level 1 is comparing several researches to come up with the A final answers, compared to level 2, double-blind research, randomized, to come up with one answer. Okay, so the question, it was poorly written. I should give you more, say, hey, we picked up 10 randomized controlled trials to give you a better understanding of level 1, so you can pick the answer correctly. So my apologies on that one. But I think we had a good key W's. One Ebony, here we go. And the winner of today's event is Reki. So all of you guys are feeling it, okay? Then we have LW and Sammy D. So hopefully this was super helpful, or you got something out of this, right? It is frustrating at times, and there's a learning process. Today you do better, tomorrow not as good, and you keep learning on your journey towards your PMHNP board certification. You will get there. Most effective way
Yeah, he's gonna come back in.
He wouldn't leave without saying goodnight. Sometimes he gets bumped out and has to restart everything to get back in.
I'm back in. Can you guys hear me?
Yes.
All right, my apologies on that. Sometimes it happens. I can complain all day long to Google, and may or may not help. So my apologies. As you study, it will be fluctuations, right? Some days you're like, man, I got it. And some days, some confusion and some the ifs of life, right? Understand that you don't have to know everything to pass the board, right? You only need 70%. Fact, right? So be mindful of what triggers you. If group or WhatsApp group is helpful, participate. If the forum in our course is helpful, participate. If it's causing anxiety, don't participate. Be mindful of how you feel. On the test date, there is our dumping sheet video. I highly encourage you to start that at least 10 days before your test. You should be rewriting all the acronyms, all the shortcuts that we have learned together throughout the course. When you sit down, you have about 18 minutes to write it down, the dumping sheet, all the Erickson, PSG acronyms, so Peter can fly, all the things that we learned throughout the course. Write them down. Because if you get a question on Erickson, and it's a question number 160, number 150, it will be confusing. You are already tired. You want this to be over. All you have to do is look at your sheet and be like, yep, right here, no doubt. This is exactly what I thought it was. I'm looking at my sheet, can confirm that by the age, it fits the description, right? Next Friday and Saturday, we'll be meeting for about 4 hours each, so about 8 hours. You have your course. 1 second, Rich. I'll be right there with you. You have your course already available for you to study. So I encourage you to go to Module 6, the PMHNP Crash Course Review, and watch the video. Download your PDF. Every single line that is in the Crash Course Review is important. You don't have to take picture. You don't have to sit down for 5 hours. So break it down in small chunks for you. You can take it 5 days if you like, but make sure you're not missing anything. I'm going to rebrand it, tweak a few things, and present in a different way. So there will be your second or third pass of the same content. Please make sure that you are taking the diagnostic number 2. We have about 700 people that took diagnostic number 1 and only 250 of diagnostic test 2, right? So where is the discrepancy here, right? So I think people are not scheduling the diagnostic test 2 as if it is the real test. So you should say, okay, the real test is on the 30th. I'm giving an example. I am going to do my schedule as if it is the 20th. As you sit down to take the diagnostic test 2, you should be in your mind, this is the day, so that you take the test as seriously as possible. What happened is that during the test, if you score more than 80, you're good as gold. You should not have any trouble passing the board. If you don't, you have 10 days to catch up and make last minute adjustment. Okay, you will be receiving a link from me if you are in the course, obviously, with the dates. It's going to be next Friday and Saturday, so no Kahoot next week. Okay, write down all your questions, informations. You got my number on the WhatsApp. Email me any questions, any concerns. Don't understand something, would like me to rephrase it, put it in a different way. Whatever you need, email me and I'll try to get back to you. So let's make this next week super helpful to you. Set aside 1 hour maybe 2 hours a day if you can, and go all in, because this is the test of your life, right?
Dr.
And
Lopez,
I
why
want
is
to
it
make sure, 1 second, please, my dear. We want to make sure that you're good to go. I have a question here, and I'll get back to you, my dear. 1 second, please. It says, so you can use the dumping sheet on the test. Okay, great question. I'm not going to say yes or no. You have 18 minutes when you arrive to the test center. They will give you 2 pieces of laminated sheet. Make sure you ask for a new Sharpie pen, right? Eraser, everything new. They try to give you old, you say, no, I don't want it. I pay for this. I want one that's going to work. I don't want this thing to fail on me when I'm taking my test. You sit down, you have 18 minutes. The clock is ticking. That 18 minutes is for you to understand how the test is usually conducted. They'll go through instructions, strike through procedures, highlighting procedures, things like that. However, most students, they got those 18 minutes. You're not cheating. It's all in your head. You have the laminated piece of paper. You can choose to read line by line your test instructions, or write down whatever you like on your laminated piece of sheet. You're not cheating. Is it from your head? You cannot look at any resources. Then you should have 3 minutes left, 5 minutes left. Simply read through the instruction, make sure you understand. They are very simple, and make sure you're good to go. If you are a spiritual person, I like to sit down, be in peace, most peaceful way possible. I'll do my prayers, make sure I'm focused and centered, knowing that I have done the work. There is only one outcome. It's not an if you will pass the board. As you have done the work, you will pass the board. It's going to be a normal day. Start celebrating before the day. So many of our students have passed the day they graduated because they started early. By the way, you have 6 months once you enroll, and sometimes a year if you want more time. My main concern is you passing the board. I don't make restrictions of what you can or want to use. If you are in the course, you have everything. Time is not a problem. I don't restrict it, how many times you can attend a live class. No, that's ridiculous. I want you to pass. I want you to come. I want you to be involved, right? By saying, oh, no, you can only attend one module 3, the person that does that is not benefiting you, clearly, right? You attend as many classes as you like. If you don't want to attend any, you don't need to. It's all recorded and available for you in the course, right? So hopefully, I'm not going to say it is legal or illegal to do a dumping sheet. I certainly think it's legal. You're not cheating. You can use the 18 minutes for whatever you want, as long as you're not bringing it with you. It's from your head. But how do you memorize that? Well, write it down 10 times before your test date. And I have made a video of what I consider to be a basis of a dumping sheet on the YouTube, right? Look at that video, see if you understand. It's likely that you may not understanding the full concept because that's acronym from the course, okay? So there was someone else that had a question. Unfortunately, I did not get your name. I think it was Samantha that had a question. Maybe it was somebody else. I think anyone that have a question, please let us know.
Is module 6 can you just get module 6? Is that the review? Can you just do that module? And that's recorded, right?
It's recorded and live.
And
so,
there's a PDF that goes with that of the notes.
Yep, you got PDF, and that will include a test the diagnostic test to see how ready you are to the test. So not only you get the recorded portion, you get past live events, and you get to attend the live events plus the diagnostic test. Now, if you take the diagnostic test and you didn't do well for whatever reason, please don't test it. Please don't test it.
So for
Because
module 6,
you go ahead.
You can just do one module. What's the cost for just module 6?
It's $199.
Okay. And that
Pretty
comes with a
reasonable.
pre and post test?
It comes with one test, yes.
Okay.
One test.
Okay. Gotcha.
So one test. So basically what I would say is if you really, that's all you want, go ahead, take the notes, take it over a 5 days period, 4 days period. You can do it in 1 day.
Okay.
But take it
And
over
you can look at it
time.
as many times as you need?
As many times as you need. You can attend the live class as well. All that is included.
Thank you.
So I'll go ahead and put the link here if you are interested. You can do that. It's a preference and also a timing thing. Is it the best option? I don't think so, because I don't want to discourage you. The best option is the one that is absolutely a surefire. You will pass the board. But now let's say you only have 3 weeks or 2 weeks or 4 weeks, and you are really pressed for time, then it is a very good option, right? Some people are with us for over 6 months.
Yeah, I've only got 4 weeks, so
yeah,
I'm gonna grab that
4 weeks. Go ahead and enroll on that, and then we'll touch base and we'll make sure that you have everything you need. So don't worry about time. Don't worry. 4 weeks. I would be honest with you. I would take the full course, but I don't know what your schedule is like. I don't know if you're working or not. I don't know if you have obligations or not. Right? The full course can be done. The full course can be done in 4 weeks.
Dr. Lopez.
And it's all recorded and available to you. So,
hello.
I'm sorry, Dr.
Yes.
Lopez, where do we find the YouTube video that you mentioned regarding your dumping sheet?
Okay, I'm going to put the YouTube channel. I do not necessarily upload my own videos. Then just search on the YouTube. Let me see if let me find it. ANCC Exam Coach on YouTube.
And I just, while you're looking for that, I did in fact enroll into your entire course. However, I've been doing it for about 2 weeks now. However, I only have 2 weeks left prior to the certification exam. So is there any advice you'd give as far as a course of action other than, of course, the crash course? Because I think maybe I'm like in module 3, because I've been progressively doing all of the videos with all of the things.
I'm looking at your progress. I know exactly where you are at the whole time. I would say complete on track, because now all you have to do, did you attend yesterday's class or no?
I did.
Okay, so really you don't have to do module 5 again. So you only have one more module. Plus module 6.
Gotcha.
Then what you're going to do is take a test on module 7 and then stop. Look all your PDFs. Look at the theme of the questions and try to understand the reasons why you got it correct or incorrect, and then match it to your PDF. Okay. Then you are going to take a pause, review everything, and take the next test to make sure that you're good to go. Plus, next week, don't miss next week's event, because we are going to go over module 6. So in summary, you really are on track to finish this in 4 weeks.
I have a question.
Go ahead, please.
I did the diagnostic test in module 7, and while I was reviewing it, is it timed as far as, because I lost it went out and I wasn't able to finish the review of it?
Yeah, so it's timed. It's just like the real deal.
No. I mean, I completed the full module, but then I like to go over the answers, and I was going over the responses, and then like after, I would say maybe after about an hour, it went out. So I don't know what happened.
It should not. It should allow you to review.
And
But once you
download
say,
it, right?
yeah. So if you send me an email, I'll find your test and I'll send it to you, and you'll
Okay.
be able to review again.
Thank you.
Yeah. So Rich, if you by enrolling on the crash course review, you'll be able to attend next week's event of Friday and Saturday, plus all the recorded time. So you should be good to go. Really, like it should be more than enough to pass. So if that answers your question,
Dr. Lopez, I have a question. Dr. Lopez, I have a question.
go ahead, Mrs. Sunny.
Okay, so I think I'm doing module 6 now, which is the crash course, right?
Right. Yes.
So after that, am I repeating the diagnostic test 1, or am I going straight to 2? I'm getting a little.
So the next one will be, have you ever seen a pre and post study where I did a lot of this, a lot of my teachings in the past or experiences, I do a pre, what they know and what they learn. So you actually are doing a study. When you first came in the course, you did a pre-test. This is you coming in. And now you're going to see what you have learned throughout these 4 weeks. That's test number 7. That's repeat the diagnostic test 1. But now with the experience that you have gained, what we should see is a 20 points, 30 points increase. What I would hope to see. Most of the people score about 45, 50 as the average. You should be at the 75, 80%. But it's okay if you're not. Then we're going to recap again and take another test. That will be the validation for your board. Okay.
So after the pre-diagnostic 1 and 7, module 7, then I do the
Module
diagnostic 2. Okay.
Yes, which is diagnostic 2. You are correct. And Annette Cruz, Mrs. Cruz.
Yes, thank you. Sorry. So I graduate in May. I'm still in school. My question to you is your PMHNP review course, the 30-day walk to success. Does that, is that everything I need for my boards? Or I'm also seeing this, the pharmacology class, is that not included in the 30-day?
Neither is included, neither is necessary for you to pass the board. In fact, I do not want you to touch that course. Okay?
So what am I supposed to sign up for?
The 30 days, that's it. I'll put the link here. Why I would say that? Why? I mean, most people would try to, enroll you and basically I'm not here entirely for money. One of my priorities for you to pass. You do not need the psychopharmacology course. That's a misconception. Every single day I answer the same thing because folks really think that you need to have this outstanding knowledge of medication. Well, if you do, great. If you don't, it's not entirely necessary because the board, schools do not teach you how to pass the board. You are not going to go over laws of psychiatry in your school, most likely. You are going to see things that are board specific. So the psychopharmacology course, it is one of the most intense course that is in the market, no doubts about that. But it's not specific for the board. It's specific for practice or for those that have like 1 year, 2 years in school, and they just want to be very good in pharmacology. But it's not specific about the board. All what you need is the 30 days PMHNP Walk to Success, and you have 6 months of access. We call it the 30 days because it can be done in 30 days. And then you can attend as many live classes as you'd like to.
How long is the access to the pharmacology class?
1 year.
Okay. All right. Thank you.
So, yes, I'm going to give you a code here. So it's in the chat box. If you use it, you get a bit of a discount there. Okay. So
Thank
what
you.
is that? HNP. Guys, I mean, I hope you can use this code PMHNP BC. That should give you a nice discount. PMHNP BC. So I really, those that are been in our class, I hope they can attest to that. We'll do anything that's within our power and means to ensure that you pass. We'll hold back nothing from you. It's unlimited everything. Okay.
I have a quick question. I graduated
Yes, please.
as well, or so I have about 4 months to go. So if I purchase the 30-day course, I will be able to consistently do that over for the next.
Yes, you have 6 months of free classes. Attend every live classes twice a week. Ask me any question. 6 months. In fact, if you need a year, take a year. Guys, every single day I get emails of how much more you will charge me. Zero.
And does that include the test grade in that 30-day course?
Everything. Only thing that doesn't include is the flashcard because that's the Brainscape app and I don't own the app. And that doesn't include the pharmacology course because you don't need that.
And then the
okay.
The modules are all recorded, so I don't have to actually.
Nope. Yep. You are right. You don't have to attend any class if you don't want to. But if you want the recorded and the live, it's all included. You don't have to choose which one you would like. All the PDFs, all the question bank, all the diagnostic tests, everything is there.
Dr. Lopez, I have a question.
Yes, please.
So I don't have to watch the Kahoot live in module 6. That's a lot of videos. We don't have to watch.
You don't have to.
Okay.
Yep, you don't have to. And I think I might take that out of the course and just put it into the in the YouTube channel. It's just some people, they're not able to attend and say, hey, Dr. Lopez, can you please record it? And they'll say, okay, fine, I'll record it and put it there. But all you have to do is modules 1 through 8. Everything else. Now, I did module 11. It was recordings that I did a lot of recordings with the individual folks that are testing. So I recorded that for your benefit.
Oh, module 11?
So you don't have to go. Yeah, module 11 is called the free, fire testing. Basically, I will ask you a bunch of questions, a scenario, and then see what you can come up with. Just me and you. Weird questions. Sometimes out of blank of nowhere. Let's see what you can give from your brain. So that way, if you encounter questions that are difficult to understand, you'll be able to say it. If you are able to say it, it's because you know the content. It should boost your confidence. Like, yeah, let's talk about psychotropic drugs. Let's talk about difference between first generation, second generation. How are they like and unlike, right? If you are able to say it without seeing by memory, you are good to go. And this is how the PMHNP crash course next week is going to be like. I'll pick somebody, instead of me teaching, I'll ask you questions directly, and then I'll have one person answer, and another person answer, and then we have this conversation. Because the course is already recorded, I could do it again by repeating the same thing, but you already have that available to you. So be more of a little bit of a conversation, a little bit of teaching. It's the same content repackaged in a different way to provide benefits to you. Okay. All right.
Okay. Thank you.
Absolutely, man. I think you had the question. Have raised your hand. I think. Could you please ask your question there?
Yeah, Dr. Lopez.
Hi.
Regarding the question bank, there are some questions that when you do it, it doesn't give you rationale when you get it right. The rationale only comes up when it's wrong. Sometimes you guess and you get the answer right, but I think adding the rationale to everything will make a lot of difference.
Yes, thank you. We are moving the question banks to our own website at this moment, so it's 1,400 questions, a lot of questions. So, but yeah, so we'll be including those for the right and the incorrect answer in the future. Can't promise it's gonna be
and
right
where
on
is the diagnostic test? Because I started doing the review, but I can't even locate the diagnostic test. I want to do.
So the diagnostic test, when you first start the course, is the first thing you do. However, if you didn't do that, you can go to all. Let's
How many questions are there?
Yes.
How many questions?
175. 175.
I don't remember.
1 second, my dear. Let me log in here and I can show you where it is located. Okay. If you can mute your mic there so we don't have interference, it will be helpful. Somebody has a hot mic.
I
All
thought
right.
the diagnostic test should be done prior, like 10 days before the exam, not in the beginning. Or am I getting it wrong because I haven't done it?
Right. You have a diagnostic test, which is the first test you do. Then you have a repeat of it to compare how you did when you first started to now, which is module 7. And then you would do another one later, which is on module 8.
I thought if you repeat it, it won't give you the accurate results because you've seen the answers.
That's valid for the last, the diagnostic test too. You are right. You don't want to take that several times and be like, yeah, I got 100%. We have 2 diagnostic tests, 1 and 2. And I say only take the diagnostic test once, the diagnostic test 2 once, because that's your valid result. You can say, yeah, Dr. Lopez, I'm good to go. I got 90%. And then go look at your test and you take it 3 times. There is no way I can possibly, at that point, say, you're good to go or not, right? Because you have taken the test 3 times. It's no longer a valid measuring of how well you will do in your test, right? So I'd say take the diagnostic test 2 as if it's the real deal, like you're taking the board today. So that way it give you exactly where you are if you were to take the board today. Okay, so I want to share with you a quick see here of how the course looks like and how to find things in the course if you are confused or you have questions. So, all right, so can you guys see my screen?
Yes.
Okay, perfect. So first of all, you arrive to your first course. All you have to do is come down and press your video.
I want you to imagine that.
Done. What you're going to find under your first video is your PDF. Download that under the first video of each module. Okay? And then you have your actions to do. Every time you finish something, you get an action. Give you a little bit of points. So that way I can track where you are. Okay? And then guess what? Next time you stop or come back, the next video will begin automatically. So here's the next video, the dopamine pathway, right? This is where I should be if I was taking this course. Now, also, I want to share with you something that we created recently, which is our artificial intelligence recording of me. So if you ask the bot here, what is the normal lithium levels, it should give you an answer. So anything that you ask the computer, it will give you an answer. If I ever talked about it, if it's ever in my videos, if it's ever said in a PDF, it will give you an answer. Please use this resource, because basically you can go through the video and say, what did he say? Or how is that possible? And then find the answer. Or if you're confused, ask the computer or AI here, and they'll give you the answers as well. Okay, so it's located right here. So this is a great resource for you.
This is very more helpful because
Yeah.
I've been trying to locate this page and do what I need to do, but
Okay.
Yes, I have
Now,
yes, thank you.
so you can go here to all trainings. If you don't, I would prefer you to see one training at a time, because guess what? We have 100 trainings here for you. But if you would like to know what's next and what you will be covered, you can do all trainings, pick a module that you would like to start today. Let's say it's module 1. Click module 1, and then you have all your trainings for module 1. So here we have the cerebrum, the clock drawing test, the limbic system, cranial nerves, dopamine pathway, EPS, pharmacokinetics, pharmacodynamics, neurotransmitter, lithium, valproic acid, carbamazepine, lamictal, mania, depression, clozapine, alozapine. So when I say that you don't need the psychopharmacology course, it's because I'm already covering you what you need in this course. It's not that you don't need to know any medications, but the psychopharmacology course is so in detail that would not be beneficial to you. What you need is something that's focused, high yield for the board. And here you have your 23 trainings for module 1. It's up to you. How would you like to go by it? I like one training at a time, but you can say, hey, I like to see what's next. And then you can pick and jump around as much as you'd like to. You can go to module 2 and see, hey, what is being covered on module 2? Okay, let's take a look. The difference between MMSE and MSE, clinical presentations, suicide risks, substance use disorder, anti-abuse, how to manage opioids, how to manage a comprehensive assessment, and so forth. It's one by one: schizophrenia, delusion, neurocognitive disorders, dementia, and few of the Kahoot practice that we had. You don't have to watch the Kahoot. I would prefer you not to, because your time is valuable, right?
Yeah.
Participate if you can. All what you have to do is your lectures and download the PDF. Once again, PDFs are located under the first video of each module. So if I click here, the first video of module 3 is tolerance. So let's talk about tolerance. Okay, then you click here, then you have your video. Right?
Hello, everyone, and welcome back. So happy to see you here, studying hard.
Boom, done. And guess what? Now we have PDFs for you. Download your PDF, follow along, make your notes, move from one module to another, attend the live classes if you can, unlimited classes. And you should be excellent position to pass the board with no problem. So if I haven't looked at my phone today, but I promise you that every single day there is people passing and texting me. Let's see who passed the board today. Let's see, so many congratulations. Let's see. Cristo. Who else? Every single day, we have tons of people on our WhatsApp passing the board, and you guys are seeing this every single day, right? So just keep doing it, what you're doing it. And if you have questions, I'm there for you. Email me any day, and then we'll try to clear up any of your questions or concerns. So I put it the course. You have go to our website, www.npexamcoach.com. I think a great deal would be the 30 days walk to success. If you use the code PMHNP-BC, you get $150 off there. Should be a nice discount. Any questions about the content that we cover? Go ahead, please.
Can you repeat the
code?
The code?
Yes, it's in a chat box. PMHNP PMHNP-BC. It should be working. I don't manage those things, but they should work. I put in a chat box there. Okay. If it doesn't, email me. Also, my email address, PMHNP@NP Exam Coach. Anything you need, any questions about anything, please let us know. It can be question bank. It can be explaining. I talk to some of you guys almost on a daily basis. Some of you guys are emailing me almost every day. And that's totally okay. That means you have a question. And my job is to really answer those questions. You know, so this is not one and done. You show up on a Zoom meeting and figure it out. And no, it's not what I want out of this. I really want that your success is my goal. 100%. Okay. Email me PMHNP@NPExamCoach.com. PMHNP@NPExamCoach.com. Of course, we are on social media, but it's very hard to keep up with everyone on social media. You ask me a question on Facebook, on a WhatsApp group, I may or may miss the question. If you send me an email, I'm always available. So please, 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 I don't want you to miss a question or concern and feel that it was not addressed. So you have to email me, okay? Mrs. Clover, I think you have your hand raised there.
Yes, hi, Dr. Lopez. Hi, everyone.
Hello.
On a comment regarding Pierce that's on here that's just starting, I can attest to Dr. Lopez's patience. So if you're just doubting, you can jump on right in. He's been patient with me. I started this just before my last semester, and I was working on a doctoral dual degree. Call me crazy, but I was. And I emailed him, I spoke with him, I explained to him, and he was patient with me. I'm still here because, of course, I had to go through everything, write my dissertation, have it corrected and published. And as long as I kept up with the email, let him know where I was and was honest with him, you know, he see me struggling and he would reach out. So if anyone doubt, I'm here to attest to that. He's been very patient and, you know, just come on aboard. We welcome you. So don't doubt it. Just come on aboard.
Yeah.
Okay.
So thank you for saying that. I really appreciate it, but also warn everybody else that if you log in the course and I haven't seen you for 1 week or few days, I'll be emailing you, and I don't mean to be intrusive, but I care that I find out, hey, I haven't seen you in a week. Is that something that's holding you back? And maybe health, maybe concerns about money or whatever. To me, all I care is how can I help you, right? At the end of the day. If you have a condition or something that's happening, let me know. If you need to extend for more than 6 months, it's never a problem. Ever. Will never be a problem. No one ever said that I charge anybody for anything extra. I wake up sometimes, I can't do this for everybody. I wake up at 5 o'clock in the morning. If you feel like that you really need me before a date, your test date, I try. I can't do that every time for everyone. But if it's up to me, we'll be starting 24 hours together. Because I really think I value that this is the most important test for you. And I really want you to walk in the test center feeling, I got this, right? Nothing will stop me. It's just a passage. It's just another day, okay? So this is my wish to you, my goal to you is that you will pass the board. I have no doubts. But I want you to walk in there just like, give me this. This belongs to me, okay? This is not, you know, this. I worked very hard for this, right? And we're going to make this in a way that's not so comprehensive that you have to pick up a book and read the book entirely. I already read the book. I already took the notes and I put it in a PDF so that you don't have to. Now, if it comes across you don't understand the difference between schizoid or schizotypal, and the note is not very clear, ask my AI bot. You know, I have to sell a car to build this for you. Ask it. It's going to give you the answer. You still don't have the answer, then go back to the purple book. Go read the book a little bit, 1 page or 2. you don't have to read 700 pages anymore because that's been done for you, right? That should save you, took years to digest all this and put into a smallest package possible, between covering 30 different herbs and covering maybe 3 or 4 that you might see on your test, right? So still, I'm not saying that's oh, you go through like this, right? Take the time that you need. If you want to, it can be as fast as you like, or it can be as slow as you like. So you call it how you want to learn it. You want to attend the live classes, you can. You want to attend both, you can as well. So Mrs. Ohowa, I'm sorry if I Hamadat. I'm
Yes.
How do you say
Good
your name,
evening,
ma'am?
everybody. Good evening, Dr. Lopez.
Hello.
Lopez.
Hi.
My name is Hamdat. I bought
Hamdat. Sorry.
I bought the whole package way back in November,
Okay.
but I did my graduation in January. I'm
Okay.
waiting to test. I've been using your YouTube channels.
Perfect.
I've been doing a lot
Great.
of work on that, doing the Kahoots and
Yes.
everything. But my question is, I want to buy the question bank. How do I go by it? Because I pay for the old thing, the 249 for the old thing, but what I'm missing is the question bank. How do I get
What do
it?
you mean? What do you mean, Olton?
The question bank.
So did you enroll in our course before?
Yes, I bought
Okay.
the old
So
thing,
my dear, it's
249.
free. There is nothing for you to buy. It's free. It's part of the course. So email me, PMHNP at ANCC Exam Coach.
Okay.
So you know, look at your email. You have received an email from me with instruction on how to access your question bank. If you are
I
in the
did.
course, yeah.
I was
So go
unable
ahead
to.
and email us, and we'll take care of you. So there is nothing for you to buy. Okay.
Okay. Okay.
So yeah, we'll go ahead and discuss your case, but it's all included. The you know, we try to put everything in one package. You know, people buy it all the time, and we go return money, because it's not what we do, and it's not our, you know, we don't. No, it's free. It's part of. It's not free. It's part of your course. Okay. All
Okay. Thank
right.
you so much, Dr. Lopez.
My pleasure.
I
Anybody
would
else?
check your
Go
email
ahead.
first because he sends out 2 emails when you first enroll. The one
Yes.
that lets you access the modules, and then the one for the question bank. So I usually just type in NP exam coach or Talus or something like that, and then it will pop up. You'll find it, I think.
Yes. And if you have questions, let us know, and then we'll walk you through. We'll do a virtual meeting, whatever you need to access what's part of the program. If you ever have trouble, we have a team that's only looking for those questions, emails, and concerns. Okay. Okay. So yesterday we covered module 5. You know, I call the easy hanging fruit because it's things that are easy, but if we don't cover in detail, you might miss those questions. Anyone has any questions or concerns about yesterday's event, or a comment or something that you'd like to clarify? Nope. Okay. Any question about anything? Any of the topics, modules 1, 2, 3, 4, 5? All right. So all what I have to say is, if you do, email me at pmhnp@npexamcoach.com, and we'll cover anything that's in a course in a different way that kind of helps you better understand your questions. Okay. So someone just texted me and says, Dr. Lopez, if you have someone on lamotrigine and what was her questions? Yeah, 1 second. I just want to clarify this because this is a very important topic. While the person did have the knowledge to fully understand, she still picked the incorrect answer, right? So let's just cover this question here real quick, and then we'll call it a day. Okay. So You don't have to say who you are if you're here today, okay? Just want to kind of ask you a question. I'm not sure about this answer. I thought it was option B, since the clarithromycin is an inhibitor. I suggested that we may need to discuss to decrease the targetol level. So basically, you have a question in which you have a targetol level. Patient is stable. Somewhere along the lines, clarithromycin was added. What is going to do what's going to do to the targetol? Is it going to increase or decrease the level? Well, let's break this down. What's clarithromycin? Is it an inhibitor or inducer? Okay, let's break it down a little bit more. What is an inhibitor? What does it do? Nobody?
They increase drug levels, right? Inhibitors.
Yeah. So inhibitor is here. So inhibits the medication from leaving the body. So therefore, the other medication is going to increase. Okay. The question was super nice to say that clarithromycin. Let's see here. I'm sorry. Let me see. It actually said that clarithromycin is an inhibitor. If you have an inhibitor and an inducer, the inhibitor is going to do what to the inducer? It's going to increase its level, right? Or no?
Yes.
Okay. So be careful with this understanding and be careful what the question asks you. As a PMHNP, what is your next action? So you understood the concept. Now, all questions they don't care about what you understood. All questions on the board care is what is your next action. So you got the concept of inhibitors, inducers. You got the concept that clarithromycin is an inhibitor, and you got the concept that your lamotrigine, your targetol, I'm sorry, will be increased. So what is your next action now? Now is application. So we went from knowledge to real life or test life application. So what is your action for targetol?
Reduce the dose.
That's it, right? So we have to first understand it and know what is happening, and now we apply. So basically, she understood what was going on, but picked the incorrect answer. Maybe the question can be asked, what is happening here in a certain way, or ask, most likely, what is your action? Okay. So understanding the inhibitors and inducers is very important. And we have an acronym for inducers and inhibitors. So in that case, I suggest you to pick just one acronym and memorize it because it's long. Don't memorize two acronyms for inducers and inhibitors. You're not wrong if you do that way. It's just save some brain power for what matters the most, right? All right, so that was the simple question I wanted to cover. Any other questions or concerns? If not, you will be receiving an email from me about the PMHNP crash course review. Will be about 4 hours for 2 days. We'll be revamping and relooking at some of the strategies in a different way. It's the same thing that's in a crash course review, but presented in a different light. Okay? I don't want to take much more of your time, but it's always a pleasure to see you guys, and keep on doing it. Every single day, you are just an inch closer to your biggest dream. You know, as you move from a nurse to a provider, your life will change forever. Okay, so be blessed. See you guys next Friday and Saturday. All right, good night, everyone.
So much.
Thank you so much.
See you Friday.
Thank you.
Appreciate
My
it.
pleasure, everyone. So, bye-bye.
Good night, Dr. Lopez. Thank you.
Good night, everyone. Bye-bye.
Bye.
Okay.